Welcome to the World Sight Day of 2021. The main topic will be protecting and taking care of your eyesight. I am Dr. Rajesh from Bangalore. What we say is eyes are windows to the soul. Vision is a window to the world. With vision, we connect with others. With vision, we feel happiness. About 80% of our memories are determined, determined by what we see around us. This World Sight Day event is annual event. The main objective of this event is give the awareness of the sight and what is the visual blindness and treatable blindness. And we will be mainly focusing on what are the main problems where we can treat for the normal eye conditions. There are 2.2 billion people globally are impaired vision or blind people. Among that, around 1 million people can get, they can avoid going to blind. As per the recent study, 2% of Indians populations are blind. That means very high number. In 1.1 million, that's called corneal blindness. That's like what we see in the black part of the eye. That's called cornea. Something happened to that, maybe like injury, infections, like a normal condition like keratoconus. All those things can give you the blindness, which are treatable. Around 1 lakh cornea transplants are not or required annually in India, but eye donors are very minimal. This could give awareness to do more of eye donation towards people have a lot of thinking, uh, a taboo for eye donation. Normally in eye donation, we'll be using the cornea normally, but from the recent years, the awareness towards the eye donation is increasing, but still it is insufficient. Normally what we see, uh, the vision, whichever we see, that goes to the brain, that will feed and stay there for some time. And whenever you see the same object later on, your natural resources will get back to you and think, okay, this object which I seen already, I know it. The common eye problems are refractive errors, like glass problems. Either people like engage, people at the age of 40 and the old age also. And the commonest among all this nowadays, everybody wearing the mask, dry eyes. Dry eyes is such a common eye problem. If I start counting, if you wear mask, you get the dry eyes. You sit in the AC, you get the dry eyes. If you sit in the car, windows down and drive, get dry eyes. While driving two-wheeler without protection of goggles, you get dry eyes. You see mobile computer for long duration, you get the dry eyes. Females who have a hormonal imbalance, dry eyes. People who have comorbidities like diabetes, hypertension, thyroid, they tend to get dry eyes. That means dry eye becomes such a common problem. Any individual on earth can be get the problem of dry eyes. And presently, from past 2 years, we know everybody stick to online classes, more of digital screens. It is giving a strain. That's called digital strain. Bangalorean, we know because we have a lot of trees and pollens, we get allergic conjunctivitis, allergic rhinitis is the commonest thing. And few things like can be cured vitamin A deficiency, and they give you night blindness, color blindness, those things due to the vitamin A deficiency. And in the kids, normally what we like to focus in the kids mainly is the lazy eye. That means people have a problem in the eye, like a refractive error, some other problem. That and common problems in the geriatric age, like I seen, like young age, now the geriatric age could be presbyopia. When you're 40, 45 years, you start wearing glasses for your near vision. That called presbyopia. Cataracts. Once you become little age, like 55 to 60, with so many other factors, they get the cataracts. And people who have more than 40 years, we tell them to screen for glaucoma. People who have more than 63 to 65 years cause age-related macular degeneration. And we know, like everybody talks now, diabetic, diabetic, diabetic. In the eye, it's blindness due to diabetic retinopathy. Normally, here I want to give a little press on this diabetic retinopathy because blindness due to diabetic retinopathy is irreversible. And now we can say like young people between 18 years to 40 years. A lot of people will have refractive errors. In that, main thing is the myopia. Myopia is normally what we call as short sightedness, short nearsightedness, short sightedness, like short sight. Normally, what they do is they cannot see the far objects, or they cannot focus. Normally, we start seeing at early ages sometimes, maybe commonly we notice at school going ages. Then it goes on increasing up to 21 years. Uh, Normally, how to detect kids have this problem? They try to go near to the TVs to see. While reading, writing, they go very near to see that. Third, they will be squeezing their eyes to focus on something. Okay, we can see now, like squinting or doing. And some people commonly, they if they cannot express these feelings, they say like headaches, eye strain, like that. Other things the parents normally notices the kids start coughing. The second one is hypermetropia. It's called farsightedness. Same thing here also, same people, uh, same, they cannot able to focus properly in the class. For them to treat one treatment, the same thing. Once again, the glasses we give at once they cross certain age, 18 to 21, they would do by doing laser refractive surgery. And in the kids, I told you already, it's called amblyopia. Amblyopia is called dull eye. Is having less visual function than the other eye. People normally, how we can say is people started using the other eye. Normally, they should have like a head tilt like that. They'll be just moving their head away from that place and try to see with one eye because other eye is not helping like that. Some people may not be knowing the problem. Some people like parents get the kids saying he's squinting too much, is gone inside. When we check, the common problem will be the refractive errors. Maybe one eye will have a -1 or -2, the other will have -5, -6. Because of this disparity, the eye which have less power will be functioning more than eye which have higher powers. In this, normally what we used to do previously is like a patching the eye. Maybe the normal functioning eye will be patching it. With the disease, we try to focus more and more. Otherwise, if you have some other problems like they have like childhood cataracts, some other problems, yes, we have to operate, take out the cataract. Here, early diagnosis of amblyopia is the best treatment. If you delay that, the problem may be permanent. We may not get back his vision. I'll say you should work between as early as possible, and best if you start correcting the amblyopic eye problems by age of 8. I see a lot of people get back even almost near normal vision. People have normally says, doctor, I have astigmatism power. What exactly we say astigmatism is? Normally the black part, which is like normally round in nature. In this condition, it won't be round. It is like a back side of the spoon. One side is bigger than other side. This gives a small irregular vision. Either one vision will be falling on the retina, the other part will be like in front of retina or behind the retina. For this commonly, people try to squeeze their eyes and focus it. For this also same, we can treat with glasses, we can do with contact lenses, and once they attain certain age, we can do laser refractive surgery. And one more is the strabismus. That is like squinting, like inward squint, outward squint, like esotropia, exotropia. Normally, some people, they look straight. If they are not attentive enough, they are not focusing at one part. Whether I start moving slowly away, whether I start moving slowly inside. These are called phorias. When they're active, yes, both eyes look straight. When slightly not focusing at what they're doing the work, I start moving away. This how the normally other parents will come and tell, sir, when we click the photos, his one eye will be away from what we are clicking it up. Otherwise, his eye looks perfectly normal. During the photos only, they see eye is moving. For this normally, if it's a 4 years, yes, we do few exercises like ocular exercise. Normally we say nowadays it was yoga for eye. We can correct this. If this permanent damages, if you're not able to move, yes, we have surgeries for that squint, and we can get back eye into the parallel positions. Here also say early diagnosis and early treatment is the best option for these conditions. And second, last time we told you like one eye is a ptosis. Here also same. But normally like they observe in the photos only. When they see in the photos, one eye lid will be little down than the other eye. With this also can cause some people if it is the lid is with too much down, maybe more than center of the eye. It can give you the amblyopia because of the lid continuously pressing on the eye. It can give astigmatic powers. The same here also. Early diagnosis treatment is the must. If anybody like saying like uh, not able to cope in the classes, ptosis, squint, early diagnosis and treatment is the best only option. And I was telling you, around 1 million people are blindness due to the corneal causes. Corneum is the black part of the eye. It can be infections like a corneal ulcers. It can be injury like corneal tears. It can be, I told you, astigmatism. When astigmatism is too much, like one side of the eye, the other cornea, which is two cone, it is like a conic cornea. That's called keratoconus. All these things uh, can be corrected. If the infection is there, yes, see like redness, pain, watering, all those things. For that, yes, we use drops, ointments, medications to control the infections. And other parts like keratoconus, yes, we have other things like if early stages of keratoconus is diagnosed, to strengthen the cornea, we'll be doing uh, corneal cross-linking technique. We can strengthen the cornea, reduce the cone shape of the cornea. The second thing is normally we come as like allergic conjunctivitis of the pink eyes. That could pink eyes may be like conjunctivitis or allergic conjunctivitis also. If it is infective, yes, we have to treat with antibiotics, sometimes antiviral, anti-allergic medications, lubrications like that. If it is allergic, we have to do anti-allergic medications and lubrications to control that irritation and pinkness in the eye. The other problem is like cataracts. Cataracts is our natural lens. It can be infected. In the cataracts previously, like if I remember when during my study time, we used to give injections around the eye, not to move the eye. Then we used to cut almost 12 millimeter of the cornea, take out the cataract, place lens which is like a plate like thing. We had to place inside the eye and we used to put a sutures. From there, today we do surgeries by putting a drops, and we enter into the eye by less than 2 mm. That's like you can see like injection, little bigger than our injection needle. We enter into the eye. We emulsify all the cataract, take out the lens. Previously we used to form like a plate. Now it is we can fold it and we can inject into the eye. That will can that can correct eye will power, eye power, not eye power, eye pressure, which is more than the normal range. Normal range is between 14 to 20. Once it is more than that, the pressure inside the eye give a little pressure on the nervous system of the eye. Then there will be functional loss of the retina. That means the vision. That causes glaucoma. Glaucoma is a condition where a person who have a glaucoma, they may not be knowing until diagnosed by checking the tension, checking the visual fields, checking there inside the retina. Then only we can diagnose the glaucoma. Yes, patients are rare conditions are like they come back with very big eye. Some people have like a high plus powers because they have eye is very small. The contents eye may not be properly arranged inside that. Normally, like what we say is, previously we used to say if you're 40, you need to get check your eye tension once. You're a female, check your eye tension once because you are more prone than the male. Uh, One, far-sightedness, as I told you have to check your eye tensions regularly. You have other condition morbidities like diabetes or hypertension, check for glaucoma. If you have a family history of glaucoma, you better check your eye tension or other visual fields and all the tests. Glaucoma can be treated by using a drops. Few surgeries like a trabeculectomy, those things are there. In higher conditions, like if people have uncontrollable glaucoma, yes, we have few devices which can be fixed to the eye, which can regulate your aqueous flow and reduce your tension. Third, I like to focus on one more thing is people at very old age, maybe around 63 to 65, 70, like that. They tend to have their eye, like normally in the center of the eye, called the macula. In the macula, there'll be a little degenerative changes. It's called age-related macular degeneration. In that, we have few types like dry, wet, all those things are there. But normally, these things happens at the old age. This might give some in early stages. They may not have that much visual disturbances, but as advances, they may lose the permanently the central vision. They go off. You suppose if I'm saying a clock, I may not see uh, um, the center of the clock. I may see the numbers in the center. I may not be seeing it. If I see a picture, the center of the picture I may not be seeing. The surroundings I'll be seeing. But in the glaucoma, the same opposite. When I see that, I won't be seeing the periphery, I'll be seeing the center. That's how we normally distinguish between when we say visual fields, whether he may be like a glaucoma patient, he may be like a macular degenerative patients. And I was thinking, I was like during earlier my talk, I told them diabetic retinopathy. Normally, we have few protocols in diabetic retinopathy. People who are diagnosed diabetes early ages, suppose maybe it's a juvenile diabetes, They should check their eye once they diagnosed and continuously check their eyes once in 6 months. Even for old age people like type 2 diabetes, for them also same. When they're diabetic, make sure that your eye examined by reputed ophthalmologist every once in 6 months. Why should we go for regular eye checkups in diabetic retinopathy? Because the visual loss due to diabetic retinopathy is irreversible. That's why we have to be very careful. You can ask me, doctor, what all we can get in the diabetes retinopathy. Normally, the first changes the doctor notices is we have normal blood vessels like artery, veins, all those things. They become irregular shapes. They go, the, the veins normally get dilated, all those things will happen. The second, we start seeing very small blood leakages. This kind of microaneurysms. Then they become bigger blood vessels. Once uh, the bleeding starts in the eye, the peripheral retina, they don't get the good blood supply, they start dying. Once they start, the retinal cells are dying, they releases the toxins into the eye, which is called endothelial cell growth factors. They start giving the new vessels in the eye. The new vessels are the main problem where they can leak just like that, and then the eye can fill with the blood, and slowly the vision loss happening it. And commonly people say, doctor, as a layperson, how can we can say that you observe any visual disturbances like that? Yes, once you're diabetic, your sugar levels are more than 200. Make sure that you visit the doctor once in 6 months. The second, you see a small black dots in front of your eye, too much of web patterns, some floating objects in front of your eye, you visit a doctor. Start seeing your vision start blurring. You see a doctor. Sometimes fluctuation of vision. That means when you have high sugars, your vision start deteriorating. If when it becomes a normal sugar levels, your vision will be better. And when you are seeing the vision, like I told you in the glaucoma, you cannot see periphery. In the macular degeneration, you cannot see center. In the diabetes, you cannot see here and there. Okay. Further the same. If it's the early stage of diabetic retinopathy, yes, we can treat with lasers. If it is little advanced, we can give injections and reduce the bleeding. If still advanced, we can do vitrectomy and take out the blood from the eye. And nowadays, everybody is saying because of the digital screen, everybody is saying that, doctor, I'm getting very eye strain nowadays. What to? See, normally eye strain happens when you stop blinking properly and when you're seeing the illuminated objects. Stop blinking means normally we should blink at least once in 8 seconds. Some people staring at the screens more than 30 seconds to 40 seconds at a time. That gives the dryness in the eye. Then you start giving a strain into the eye. Here, as I said, just as people start using the monitors, that's why I just taken the example of the monitor. People who continuously read, people who works in front of the AC always, people sit under the fan. I told you, like people who drive without protection, people in the car, normally what we'll be seeing is they put a AC onto the face and just drive. And that also or gives a dryness in the eye. They can have eye strain. All those things can be treated by using the simple lubricating drops. And anything to reduce the strain? Yes, we have like a lot of things in the like reduce the illumination of the lighting objects, reduce the slight contrast in the eyes, reduce the blink frequently, so many other things are there, and blink frequently. And finally, I like to give you thing is Who are all need the regular eye checkup? People who wear glasses need their eye checked at least once in 1 year. Children who go close to the screens and see, they need eye checkup immediately. Kids come back from the school saying that I cannot see the blackboard, eye checkup done immediately. People cannot read properly, they try to push the hand holding book away from them. They need eye checkup regularly. One more thing I forgot. In pregnancy, normally we say like pregnancy people, like when they have hypertension and diabetes during pregnancy, even those people need eye checkup done at the day when they diagnose diabetes. Uh, if I if you ask me, I prefer at least the lady who are pregnant and with the diabetes, at least three examinations. If they do on first trimester, second trimester, third, possible after delivery of the baby. And if they see the hypertension, yes, before the delivery and after the delivery, eye examination is a must. And people who are old age, maybe around 60, 63, they should get eye check regularly. And people who sit in front of the monitors for a long time, get your eye test regularly done. Commonly, we'll have like what is the eye regular examination. In the eye examination, what we do is we check your vision, whether we can correct your visual deficiencies by using glasses. Second, we check your color vision. Third, we check your eye tension. Fourth, we put in drops and dilate the pupil and check your retina. These are all the things we require once we are doing the regular eye checkup. And my sincere request on this World Sight Day, because we have almost 2 billion people are required for the treatable blindness cause, pledge your eyes for eye donation. Donate your eye, gift the sight. Thank you. I am Dr. Rajesh signing off.